Hello, everyone.
Hello, sir.
Hello.
Yeah, we are live now. And on the behalf of IIP India team, I just welcome you all. Today, the IIP Women's Cell UP branch is organizing this webinar, and that sorry for the delay. And Dr. Smita Singh is our speaker today, and Dr. Deepika Sharma is the moderator. I will not just waste the time more. And just Dr. Deepika Sharma, you can continue the webinar.
Thank you so much, sir. Thank you, our technical team, for the assistance in this webinar. Let's start today's session. Good evening to all. I am Dr. Deepika Sharma, State Sub-Coordinator and a clinician from past 16 years.
Maybe some network issues happened. She is not there. Dr. Deepika.
Deepika ma'am, are you there?
No, you can continue, ma'am, Dr. Shruti, if it is possible. Maybe some network glitches are there at their part.
Smita ma'am, you are there?
Yeah, Dr. Smita is there. Ranjana is here. I can just introduce Dr. Smita Singh, and you can start the webinar, ma'am.
Smita ma'am, please continue with the webinar. You can start, as already we are getting late. And
the introduction we will give in the last. Surely we will give the introduction. Okay, ma'am. Thanks.
A very good evening to all of you. And firstly, I would like to thank the Indian Association of Physiotherapists, Women's Health, to invite me for this very important and very interesting topic. This is basically a need of an hour to talk about this topic. So can you all allow me to share my screen?
Sure, ma'am, you can do. You can go ahead with that.
So, sorry for the inconvenience. Now I can join. Welcome you all of you. On the behalf of IIP State team, I welcome Dr. Smita ma'am and all participants present here. Since 2018, IUPWC aiming at conduct free and low-cost knowledgeable activities, both online and offline, for students and professionals, and also spread knowledge and awareness among public and students. In this service, we as Uttar Pradesh team, Dr. Shruti Sharma, Dr. Anjana Tavatia ma'am, Dr. Renu Giri ma'am, Dr. Namrata Suri ma'am, and I, Dr. Deepika Sharma, are grateful to our IAP President, Dr. Sanjeev Jha sir, our IAP Treasurer and IAPWC National Head, Dr. Ruchi Vashne ma'am, our Zonal Head, Dr. Smita Singh ma'am, all our active district members and all participants who are present in this webinar. Before starting, let me introduce our resource person and speaker, Dr. Smita Singh ma'am. Dr. Smita Singh ma'am with doctorate degree in nutrition and has an experience of 18 years in the field of teaching, research and clinical dietetics. She has been working as a clinical dietitian in many reputed multi-speciality hospitals like Neera Hospital, Hind Hospital, Shekhar Hospital, etc. She is currently working as a chief dietitian at Midland Health and Research Center. She is also a Vice Secretary of Indian Association of Parenteral and Internal Nutrition IAPEN and life member of Indian Dietetics Association, being among the most experienced dietitian working in this city. She is also conducting internship programs for the students after completing their masters in nutrition every year. Her academic interest has also observed her to associate as a subject expert with many academic institutions, government and non-government bodies to talk upon nutrition and dietetics. Sanjay Gandhi Postgraduate Institute of Medical Sciences, Lucknow, UP AIDS Control Society, NIPCCD Government Project of India, Food and Nutrition Board, Government of India, Arthritis Foundation of India, PepsiCo, Private Limited are few of them. She is also guiding many of the UGC NET aspirants to crack their exams by her enriched study material and online lectures on pan-India level. She is also nutrition expert in many digital and print media television shows, telecasting regularly at Doordarshan and ETV UP channel. It's a great pleasure to have you, ma'am, on this session today. I would like to request to take over and share your knowledge with us. Thank you so much, ma'am. Over to you. Please start, ma'am.
Thank you so much, Dr. Deepika, for your kind words. And without any further delay, I would like to share my slides. The topic for this webinar is basically, just a minute, just let me share my slides first. It's my last slide and now. So should I go with the screen sharing? Okay. So I think everyone is able to see my slides.
Yeah,
right?
yeah, ma'am. It's visible.
Okay.
It's clearly visible.
Thank you so much. Thank you so much. Okay. So my topic for today is basically nutrition in polycystic ovarian syndrome, that is PCOS. And why I took this topic, because every female, almost 60 to 70% of the females are going through this syndrome, just because of the lifestyle and so many modifications we've been making in our traditional lifestyle. So this is the main factor why this PCOS is happening a lot over here. So let's talk about why this is so much a need of an hour, because it is very much highly variable. The prevalence is so much variable, and when we talk about globally, the range starts from 2.2 to 26, right? And in India, it's ranging around 3.7 to 22.5, and you won't believe this data is the people who've been diagnosed with the PCOS. Almost 70% of the affected women are remaining undiagnosed. Can you just see the figures when these 70% will come up with this disease and they'll address it? So before starting off the PCOS topic, we should be knowing what exactly it means. Like PCOS is what? Polycystic ovarian syndrome, and it is basically a set of symptoms which is related to hormonal imbalance that can affect your woman or a girl, especially of the reproductive age. So a lot of symptoms are there. So they are actually what? They are multifactorial. And the polygenic conditions which have been seen is having excess of androgen reproduction by the ovaries. Everyone knows, because everyone over here is from medical background, and everyone knows that ovaries and all the male, either male or female, both secretes both of the hormones, either male or female. They both secrete them. And we are specifically talking about the male hormone, that is androgen, which is producing by the ovaries. It is affecting most of the time this one. So the most frequent endocrine problem in adolescent age group, which actually is between the 12 to 45 years, this is almost 5 to 15%. And when we talk about the features, what are the main features for the PCOS? They includes irregular periods, excess of androgens, anovulation, hirsutism, and polycystic ovaries. The cysts are developing in their ovaries. So how you can define? There are various societies and associations which describes, and when we specifically check on the all the definitions, which is like NIH, that is National Institute of Health or National Institute of Child Health and Human Diseases, and the European Society of Human Reproduction and Embryology, and American Society for Reproductive Medicines. And again, one more society, which is Androgen Access Society 2006. They all say that there is an increase in androgens hormone in all the PCOS people. Because of them, there can be a menstrual dysfunction. Menstrual dysfunction means what? That is having oligoovulation or anovulation, and there is a cyst in the ovaries. So the definition remains the same. Either any of the society or association defines it. So what is the pathophysiology? When we talk about the pathophysiology of PCOS, we should be knowing what are the different hormones are doing in your body. So there are various hormones. The first one we'll talk is the gonadotrophin releasing hormones. And they actually, what they does, they increases the frequency of hypothalamic gonadotrophin releasing hormones pulses, which actually increases the LH secretion, that is luteinizing hormone secretion. There are two more hormones which is very, very important for the menstrual cycle, that is luteinizing hormone and follicle stimulating hormones. So at the beginning of the cycle, of the menstrual cycle, what exactly happened? The LH and FSH occurs in a same ratio, that is 1:1. Then what happened at the time before the ovulation, that is a day before ovulation or 24 hours before ovulation, what is happening? The LH surge, and first they surge and then they come back to the normal range. Now, the woman with PCOS, they still have the LH and FSH within the normal range, but the LH is to FSH ratio actually is a little bit more. That is 3:1. So what exactly happens? The LH levels are more, they are persistent rapid at approximately one LH pulse per hour. So as there is no LH surge, there will be no ovulation, because at the time of ovulation, the LH has to be under surge. Now, another hormone, that is testosterone, what it is happening, the PCOS women have an increased level of both the total testosterone and free testosterone, which is due to the low of what? Sex hormone binding globulins, which is very much low in PCOS patients. Now, even a very slight increase can actually surprise the normal menstruals and ovulation. So testosterone levels had to be in a lower range. The next very important female hormone is estrogen. Now, the thecal cells, the ovaries, which produces androgen in response to LH. Once the LH started, the thecal cells started producing androgen. And this androgen, the excess of androgen, is being converted by estrogen by FSH-induced aromatase in the neighboring granulosa cells. Now, once the FSH is in a lower range, as you can see that the LH is to FSH ratios turn out to be 3:1. What exactly happened? The high level of androgens cannot be converted into ovaries, and thus there is a hypoandrogenism. So whatever we have talked about, we'll just see it in the pictorial form. You can see this hypothalamus is secreting gonadotrophin releasing hormones, which stimulates the anterior pituitary to release FSH and LH. FSH is what? It is producing aromatase, and LH actually helps to the thecal cells to secrete androgen. Once this androgen is been converted to estrogen, oocyte starts developing. You can see there's a surge where the oocyte has been released, right? But in this is the portion which is talking about the hypothyroid PCOS woman, where the FSH level is very much insufficient, which then cannot stimulate the granular cells to convert this androgen into estrogen. Very few androgens are being converted into estrogen with aromatase, and this is the main reason where there is no oocytes being developed. Okay, so I think so very much you must be very much clear what exactly happened with the PCOS females. So there are various criteria like oligomenorrhea or amenorrhea. That means there is no or very less bleeding, or just after 2 hours, 3 years after menarche. Because when the menarche happens, there is again a small oligomenorrhea and amenorrhea. So then there is a clinical hyperandrogenism, which stimulates acne and severe menstruation, and the biological hyperandrogenism, that means there is an increase of LHS to FSH, which we already talked about, that is 3:1. Apart from that, there is an insulin resistance, that is hyperinsulinemia, and this can causes acanthosis. As you can see, black heads lines on the neck of the females who are having hyperinsulinemia, and abdominal obesity or glucose intolerance. Apart from that, there is polycystic ovaries on the ultrasound when we look for this. Okay, so other clinical presentations shows that there's menstrual irregulation, obesity, cosmetic concerns like acne, and long-term can be your cardiovascular dysfunction or cardiovascular diseases. Apart from that, abnormalities of the surrogate markers of cardiovascular disease. And as you can see, there is a hyperinsulinemia. There are chances of type 2 diabetes for these students, for these females also. Now, apart from there is a various psychological issues also, like depression, anxiety, obstructive sleep apnea, and so on. So what are the causes? Causes can be your, you can see that pituitary glands are the important endocrine glands, which are helping that menstrual cycle to be in a normal range. So if there's abnormal pituitary functions or persistence of physiological hyperinsulinemia, there are various environmental factors also. Changing in the lifestyle of the modern society, they can be a genetic factor, and also if there is a lack of exercise. So it is very important to diagnose as early as possible. So the adolescents, especially we can talk about adolescents at very high risk of developing the syndrome if they are having congenital virilation, low birth weight, premature menarche, puberty, and central precocious puberty, large for gestational age girls. If your mother has a very large gestational age and the girl is born to overweight mothers, obesity syndrome, if the adolescent is obese, insulin resistant features, girls born to parents with PCOS, that is genetic factor, and also the central obesity or diabetes, in whom PCOS ought to be suspected when associated with irregular menses. Right? So we have to check on all the factors. If any adolescent is having at least few of them, you should be looking for the PCOS symptoms and PCOS diagnosis. So simply, what are the clinical tests? You can have a history taking, specifically the menstrual patterns, obesity, and absence of breast discharge. If the person is in having more than 25 BMI, and if they are having hyperandrogenism. Imaging test can be done also to check on PCOS, like gynecological ultrasonography, which shows that the ovaries follicles are very small. And Rotterdam criteria says that if the follicles are less than 12 of 2 to 9 millimeter size, arranged peripherally in the ovary, the size of the ovary can be more than 1.5 to 3 times normal. So it can be diagnosed as PCOS. Apart from that, there are various serum tests which can specified, that can be confirmed that the patient is having PCOS, that is testosterone levels, fasting insulin, LH to SH ratio on the day 3 of menstrual cycle. Okay, so prolactins to rule out the hyperprolactinemia, and TSH to rule out hypothyroidism. Okay, so American Association of Clinical Endocrinologists and American College of Endocrinology and Androgen Access Society has shown different diagnostic criteria for PCOS. If they are having chronic anovulation, hyperandrogenism, and polycystic ovaries. So they have to assess the ovarian morphology. Free testosterone level has to be also be check on to sensitize more of the determine the androgen sexes. So these are the symptoms, and I think so many of the females are somehow feeling having these symptoms in anyhow. So if they are having excess of body hair growth, weight change and trouble losing weight, ovarian cyst is there, low sex drive, irregular menstrual periods, male pattern baldness, thinning hair, high testosterone level, insulin resistance, fatigue, बहुत जल्दी बीमार हो जा रहे हैं, बहुत जल्दी थक जा रहे हैं, acnes आ रहे हैं, mood changes हो रहे हैं, and trouble with conceiving or infertility. So they are chances of PCOS. So apart from that, there are various complications if you're not addressing this syndrome seriously. So women with PCOS can develop very serious health problems, especially if they are overweight. So they can be having infertility, premature births, liver inflammation, metabolic syndromes, type 2, like type 2 diabetes, sleep apnea, depression, anxiety, uterine bleeding, endometrial cancer, hypertension, and heart disease. And the list goes on and on. So had to address it by giving a proper treatment for the PCOS. And this is the part which I'm looking for, that is lifestyle modification. Apart from that, there are various pharmacological treatments like metformin, which is a specific drug for the diabetes. Your hyperinsulinemia ke liye metformin used hota hai, along with the clomifene. And to stimulate the ovulation and to treat PCOS symptoms, there are various surgical managements like laparoscopic ovarian surgeries and electrocautery, laser drilling, or multiple biopsy. But I will stick to your lifestyle modification, that is diet and exercise, for restoring your ovulatory cycles and achieving pregnancy. So there are various drugs which are appropriate, and they can be suggested by many of the gynecologists, like oral contraceptives. Oral contraceptives, what it does, they regularizes the menstruation, reduces hyperandrogenism, improves body composition and insulin sensitivity. Spironolactone, which improves the hyperandrogenic manifestation. Cyproteron's acetate, that is potent anti-androgen agent. Nastradine, which has been very much used to potent the anti-androgen agent. Eflornithine, that slows the hair growth everywhere or just on face. And metformin, which improves the ovulation and glucose tolerance and may also reduce the testosterone levels. There are various cosmetic therapies like hair treatment or topical treatment, which includes eflornithine hydrochloride. There are various insulin sensitizers which have been used, and the most important examples are metformin and thiazolidine. Apart from that, it has been seen that PCOS have a very much high fertility concern, and the management is important for treating this syndrome. Okay, so there are various recommendations from the international evidence-based guidelines, and they say that the lifestyle is the most important guideline, the most important thing to be checked on for improving this PCOS. So healthy eating and regular physical activity should be recommended to achieve or maintain healthy weight and to optimizes the hormonal outcomes, general health, and quality of life across the life course. So if the patient is having BMI more than 25, they had to start eating. Apart from adiposity, hyperandrogenism, or insulin sensitivity, they had to reduce the weight from 5 to 10% to improve the endocrine and metabolic status. So the diet for PCOS is a variety of balanced diet approach which could be recommended to reduce the dietary energy intake and induce the weight loss in women with PCOS and overweight and obesity. So these studies all says that you had to first reduce your weight. Apart from that, there are general healthy eating principles which should be followed across the life course. Not only that time, you had to follow this general healthy eating practice the whole life course. And to achieve weight loss, there is a need to have a calorie deficit of 30%, or you can say 500 to 750 calories per day has to be reduced from the actual calories which you are consuming right now. Okay. So in women with PCOS, there is no or limited evidence that any specific energy equivalent diet type is better than another. And there is any differential response to weight management. So सिर्फ एक ही तरह की डाइट खा करके आप अपने पीसीओएस को नहीं ठीक कर सकते. You need a different variety and only different patterns को आप follow करोगे with the diets, it will going to help you out. So tailoring of dietary changes to food preferences, allowing for a flexible individual approach to reduce energy intake and avoiding unduly restrictive and nutritionally unbalanced diet are important. So apart from that, there are various macronutrients which are to be taken care of and few micronutrients like vitamin D, omega-3 fatty acids, inositol, and chlorophyll. So vitamin D improves the androgen status. I think so. Vitamin D and calcium are the main ingredient which all your physiotherapists are closely related. So you can closely relate yourself with this nutrient. Actually, what they does, it improves your androgen status, improves menstrual cycle, and there's no effect on the glucose regulation or levels. Omega-3 fatty acids again improves the androgen status, and there's no effect on the insulin sensitivity. But inositol has decreased insulin resistance when you start taking this thing. And chromium, it decreases your weight and also decreases the insulin resistance. So for reducing the weight, the carbohydrate and fat has to be restricted in the diet. Low glycemic index diets, which does not increase your sugar levels in a high range, up to 85% will improve the menstrual cycle regularities and ovulation in about 6 months. This has been proved by a study which has been quoted over here. You can see in that. And dietary interventions like high protein, low carbohydrate, and low fat diet is being restricted, is being recommended, and the energy should be deficit of 500 to 1000 kilocalories per day. It is the deficiency which is being taken right now by. So the goal should be small and frequent meals. If you take a small and frequent meals, small meals frequently, you won't stop in eating much at the same time. So you are reducing your portion once you start taking your small meals. More fruits and vegetables and fibers. Again, this is the best way to decrease your calorie intake. At the same time, you won't feel hungry. So they have a very nice satiety value. Decreased sugar, fried foods and beverages. definitely, because it is a case of hyperinsulinemia. So you have to reduce the sugar levels. Switch to healthy oils. Now, healthy oils means what? Only mustard oil and ghee. They are the only two oils which are the best for your body, for your health. Apart from that, every oil has a problem. And it's very much important. In fact, आपको बताना चाहूंगी कि the mustard oil is the only oil which doesn't have a expiry date. So you can think of कि बिना सोचे समझे you can start cooking your food in mustard oil. And please, olive oil की पीछे बिल्कुल नहीं पड़िएगा. Olive oil is also a refined. So refined oil की जितनी problems होंगी वही होगी. And 90% of the olive oils which has been sold over here in India is almost farmers. If you want to go with olive oil, go with cold pressed extra virgin olive oil. Okay. Apart from that, you can go with steamed and grilled cookings. So there are various other ways to reduce your weight, that is bariatric surgery, and I'm not going to do that. But why we are talking about to reduce your weight? Because it is associated with polycystic ovarian syndromes, reduction in fertility, and ovulation. So they are all been related to your weight. So you have to reduce your weight to get in that. So obesity, should we really worry? Yes, it is a time for all the obese patients to talk about weight reduction. And when we talk about obesity, like definitely 55% of the women are overweight or obese globally. And when we talk about India, it's 20.6% of the women are obese or overweight. And the COG also said that weight loss is the first line of treatment for the obese PCOS patient. So BMI, if it's less than 20, if as your BMI reduces to 24, you improve your menstrual disorders, infertility, and rheumatism and acne. And more than 10% weight loss increase the likelihood of the conception. There are various patients of mine who comes to reduce the weight, and as they reduce their weight 4 or 5 kgs, they got their conception. Because conceive नहीं कर पा रहे हैं, because weight सबसे ज़्यादा है, and हमें यहाँ पे तुरंत जो है weight loss करने की जरूरत पड़ जाती है. And as they reduce 5 kgs, they come up with the good news. So the key nutrients which we'll talk is myoinositol, proteins, dietary fibers, green tea extracts, L-carnitine, and white kidney bean extract. So these are the few more nutrients apart from getting your weight reduction. It also helps you out for the PCOS management. So myoinositol actually helps for restoring fertility in PCOS, and these studies, there's a very nice study which I won't be talking in much detail, but the gist of that study says that based on the current evidence, myoinositol may be recommended for the treatment of PCOS with insulin resistance, as well as for improving symptoms caused by decreased estrogen in the PCOS. So myoinositol is a very nice nutrient which can be incorporated in the patients. Now, this is the beautiful pictorial diagram which shows that where you can get that inositol. So you can get it with beautiful watermelons, musk melons. They are very nice in inositols, and like oranges also, and also brown rice, liver, green leafy vegetable. तो अगर आप brown rice नहीं भी खाते हैं, कलेजी नहीं भी खाते हैं, तो कोई बात नहीं, पीत पत्तेदार सब्जियां खाइए. इस वक्त बहुत अच्छे मस्क मेलन मिल रहे हैं, वो आप इंटेक कर सकते हैं. Okay, so inositol has been associated with improvement in the number of various diseases of including your high cholesterol, schizophrenia, psoriasis, and ADHD, and of course PCOS. So apart from that, the other nutrient which we'll talk is the dietary fiber. It Once you increase your fiber in the diet, you are definitely reducing your calorie, because those foods which have a very high fiber, they are less in calories, inhibits fat absorption also, and promotes weight loss, right? High proteins provide satiety again. If you want to reduce your weight, there's a very nice way to reduce your intake of food. How? आप जो भी खाना खा रहे हो उसमें सबसे पहले अपना प्रोटीन्स निकाल के पहले खा लीजिएगा। जैसे सपोज करिए आप दोपहर में खाना खा रहे हैं, तो पहले आप एक कटोरी दाल पी लीजिए। आई नो इट्स वेरी मच मतलब ऑकवर्ड है, ऐसा हम लोग नहीं खाते हैं, बट अगर आप एक बार खा के देखिएगा, यू कैन सी दैट योर इनटेक ऑफ रोटी और राइस विल बी लेस वंस यू टेक मोर ऑफ प्रोटीन्स इनिशियली। ठीक है, तो अपना प्रोटीन्स को जैसे ही ज्यादा लेते हो वैसे आपकी सैटिस्फैक्टरी वैल्यू ज्यादा हो जाती है। At the same time, you preserve lean body mass, increase the muscle mass, and increase your energy expenditure. So this again a good study which says that the calorie restrictions rather than dietary content was associated with metabolic and hormonal improvement in the short term, and emphasizes the role of non-pharmacology interventions to reduce weight and ameliorates the anthropometrical and clinical phenotype of PCOS. The next ingredient which we'll talk is the green tea extract, and this increases your fat oxidation and also your energy expenditure. This will definitely going to help you out to reduce your weight. So again, this study, I don't want to get in detail to that study, but you can see that the PCOS figures with having very high insulin and very high HOMA IR, you can see that once you take this green tea, all these factors have been reduced. So this is the initial phase, and this is the last better way how this green tea consumption causes mortality in gonadotrophin levels, reduces the insulin resistance, losing weight, and improves your overall ovarian morphology. Now, due to the systemic effects and the ability to reduce metabolic function features, green tea is actually able to increase the reproductive rate in PCOS. The next ingredient is the L-carnitine. This transports, I think so this is also very much familiar with all the audience over here. It actually, what it helps, it transports fatty acids to mitochondria, increases your fatty acid oxidation, and thus it helps to promote weight loss. So it appears that the treatment with L-carnitine may decrease the risk of cardiovascular events by normaling metabolic profiles and the BMI, right? So this is a very small way to increase all your ingredients in a normal way, and so that you can get a L-carnitines in your diet, right? So vegetarian sources can be milk, ice cream, cheese, cheddar, whole wheat breads, asparagus, spinach, and chickpeas, and most of all the non-vegetarian products have the L-carnitine. So you can see the amount of L-carnitine in the vegetarian and non-vegetarian people. So definitely non-vegetables have more of L-carnitine than this thing. So animal products are being the best sources, right? So, acha, ek aur cheez hai, the redder the meat. One more thing, the redder the meat, higher its carnitine content. ये ध्यान रखिएगा. तो जितना आप red meats use करोगे, redder मतलब जो color जो होता है red का meat का, वो redder होना चाहिए, ठीक है? Next is the white kidney bean extract. This also helps to body fat reduction, and this is the thing. One more part which I have to talk about is that how your menstrual cycle starts. So before starting of the knowing about the menstrual cycle, You should be knowing what exactly happened. We have a 28-day cycle, and the day 0, when we starts with the first phase, starts with the follicular phase, where the estrogen levels are increased. At 14th day, the ovulation starts, and the second phase starts with, which is known as luteal phase. And in that, what exactly happened? The progesterone levels are increased and the estrogen levels have been decreased, right? So there are various ways where you can help this estrogen levels to be in a higher range at follicular phase, and the progesterone levels to be higher in the luteal phase. ठीक है? So इसके लिए एक seed cycle इजाद किया गया, and I have been using the seed cycle very frequently with my patient, and they are getting a very nice response. जैसे आपको पता है follicular phase, that is the first phase of the menstrual cycle, what exactly happened? You had to help to increase your estrogen levels. Okay? So for that, you should be including your pumpkin seeds and flax seeds. Pumpkin seeds, the flax seeds contains lignin, which binds with the excess of estrogen. So you had to improve your estrogen levels while preventing excess of estrogen. There shouldn't be more of estrogen, but there has to be improved estrogen level. So flax seeds क्या करता है? ये आपके जो excess of estrogen है उसको bind करता है, but at the same time the pumpkin seeds, which are very high in zinc, helps to support progesterone production as you move towards the progesterone rise in the second phase. ठीक है? जो luteal phase है जिसमें हमारा progesterone levels को ऊपर होना है और जो है estrogen level को at the same time down करना है. तो उसमें क्या होता है? We used to use sesame seeds and sunflower seeds. Sesame seeds क्या होते हैं? They are very rich in zinc, which helps the progesterone levels to increase, and then they also contains lignin, which blocks the excess of estrogen levels while progesterone rises. ठीक है? तो हमें करना क्या है सेकंड फेज में? हमारा सेकंड फेज में प्रोजेस्टेरोन लेवल अबव होना चाहिए और एस्ट्रोजन लेवल डाउन होना चाहिए. तो सेसमे सीड्स क्या कर रहा है? प्रोजेस्टेरोन को तो बढ़ा रहा है, लेकिन एक्सेस ऑफ एस्ट्रोजन को रोक रहा है. सनफ्लावर सीड्स जो होते हैं वो होते हैं हाई इन विटामिन ई एंड सेलेनियम. सो विटामिन ई हेल्प्स टू बूस्ट ऑन द प्रोजेस्टेरोन प्रोडक्शन. ठीक है? एंड ऑफ कोर्स सेलेनियम जो है उसमें they helps to detox the liver of excess of estrogen. ठीक है? तो excess of estrogen नहीं होने देते हैं luteal phase में by these two seeds. So इसको आप अगर समझ सकते हैं तो 2 चम्मच अगर आपने सनफ्लावर follicular phase में शुरुआत करेंगे मंथ की, तो 2 tablespoon of pumpkin seeds and 1 spoon of flax seeds, 1 spoon of pumpkin seeds and 1 spoon of flax seeds to be taken. And the luteal phase after 14 days के बाद आपको sesame seeds and sunflower seeds को 1-1 चम्मच खाना होगा, जिससे कि ये आपका बैलेंस बना रहे with your what menstrual cycle. ठीक है? तो ये सीड साइकिल एक इनफैक्ट मैं आपको बताना चाहूंगी कि एक मेरी बहुत ही पुरानी पेशेंट है जिसने जो गोरखपुर से है, एंड उसका जो है मेंस्ट्रुअल साइकिल स्टार्ट हुआ एंड शी हैड सम लिटिल बिट ऑफ प्रॉब्लम्स. तो उन्होंने वो फीवर हुआ था और वो दिखाने गए डॉक्टर साहब को. तो डॉक्टर साहब ने कहा कि क्या वो आपको पीरियड्स आते हैं? उसने कहा कि अभी नहीं आ रहा है. एंड उन्होंने जो है उनको सारी दवाई देना शुरू कर दी. जिस दिन से दवाई देना शुरू किया उन्होंने सारे मेंस्ट्रुअल साइकिल के लिए, एंड दे उसके साथ प्रॉब्लम क्या हुई कि जब तक वो दवा नहीं खाती तब तक वो उसका मेंस्ट्रुअल साइकिल कवर नहीं होता है. सो इट्स लाइक इनिशियल स्टेज में ही अब क्या हो गया कि वो बिना मेडिसिन से उसका PCOS कवर ही नहीं हो पा रहा था. So I have given this seed cycle, and after 3 cycles, उसकी menstrual cycle without medicines cover होने लगे और ठीक होने लगे. इसके साथ साथ हमने definitely weight gain बहुत ज्यादा था, उसका वेट ज्यादा था, वेट लॉस भी किया और साथ में ये सीड साइकिल किया. तो ये दोनों की जो साथ में सब ट्रीटमेंट स्टार्ट हुआ तो it helped you out. So you should be stronger than PCOS, because heal symptoms with the rich Indian diet formulated by the experts. Never believe, I'll just stop my slide and my talk with this slide, that is, never believe the lines on your hands that predict your future, because people who don't have hands also have future. So believe in self and have a healthy and best practice. Thank you so much.
Thank you so much, ma'am, for sharing such important and knowledgeable facts about PCOS. And we are very thankful to you.
I'm just waiting for any questions.
Yeah.
क्या आप में से किसी को भी PCOS की problems हैं? If you are facing these PCOS problems, या आपके
Ma'am, good evening. Ma'am, good evening. I'm Dr. Shruti. Hi, ma'am. मैम आई थिंक जो आप सिम्टम्स बता रही थी, मुझे ऐसा लगता है कि शायद थोड़ा बहुत मेरी डॉक्टर में है ऐसा कुछ. तो आई फील लाइक कि ऐसा कुछ है सिम्टम्स, बट जितनी बार भी अल्ट्रासाउंड कराया है, रूल आउट कराया, तो उसमें नहीं लग रहा. बट उसका वेट गेन और ये सब कुछ है. So क्या ये फ्लेक्सीज एंड ऑल विल गोइंग टू हेल्प?
That's what I'm saying, because ये मैंने स्लाइड सिर्फ इसीलिए ही दिया है, because इसके कोई साइड इफेक्ट्स नहीं है, and it's going to help you out to monitor and to regularize your hormone secretions. तो अगर आपको लगता है, बिकॉज क्या होता है ना, PCOS का जो है बहुत बार ऐसा होता है कि इट्स बीन नॉट बीन डायग्नोस्ड एट द राइट. तो you should be going with these seed cycles, और ये seed cycles कुछ नहीं करते तो at least they are getting good proteins, good omega-3 fatty acids, inositols मिल रहे हैं, तो ये सब के सब helpful होंगे. So I think so with that, and also please weight loss करवाइए, promote.
तो मैं आपसे ये सीड साइकिल के बारे में आपसे पर्सनली डिस्कस भी करूंगी अपने बेटे का, कि किस टाइम पे किसको कैसे देना है और क्या करना है, बिकॉज उसका फैट बहुत ज्यादा होता जा रहा है एंड मूड डिसऑर्डर्स एंड ये सारा कुछ है. मतलब जो सिम्टम्स आपने मुझे अभी बताया हम लोगों को.
एज क्या है मैम?
शी इज अराउंड 24.
ओके.
सो वो सारे सिम्टम्स मुझे जो रिकॉग्नाइज कर पा रही थी जो आपने अभी बताए, सो दैट्स व्हाई आई आस्क्ड. एक और क्वेश्चन था मेरा आपसे.
हाँ बताइए.
एक और क्वेश्चन था मैम कि क्या हाइपोथायराइडिज्म में भी या सीड्स हेल्पफुल होते हैं?
देखिए, हाइपोथायराइडिज्म में सीड्स इज नॉट गोइंग टू हेल्प यू आउट. हाँ, बट यू कैन, सीड्स से आपका वेट लॉस हो जाएगा, बिकॉज जो गोइट्रोजन्स हैं उसको हमें रिस्ट्रिक्ट करना होता है. तो गोइट्रोजन ज्यादातर आपके जितने भी सोयाबीन होते हैं, कैबेज है, कॉलीफ्लावर है, क्रूसीफर फैमिली की जितनी भी सब्जियां होती हैं उसको रिस्ट्रिक्ट करते हैं. एंड थायराइड अगर इनिशियल शुरुआत की टर्न पे, बिल्कुल आपको जस्ट इनिशियली अगर आपने डायग्नोस हुआ है थायराइड, तो आप वेट लॉस करो, थायराइड की मेडिसिन खाओ, एंड उसके बाद आप 1 महीने का विंडो पीरियड ले सकते हो विदाउट टेकिंग मेडिसिन, एंड ओनली द डाइट एंड वेट लॉस डाइट करके. तो बहुत सारे ऐसे हैं जो कि जिनका वापस बढ़ा नहीं, एंड नाउ दे आर नो विथ मेडिसिन.
ओके,
बट उसके लिए ना थोड़ा सा क्लोजली मॉनिटर करना पड़ता है, बस इसमें ये है.
राइट,
ये भी इनिशियल वाला पार्ट होता है.
ओके, थैंक यू मैम. थैंक यू.
थैंक यू.
दीपिका मैम, एनी क्वेश्चन आती है?
Anyone has any other query? Please ask with ma'am. Anyone? I think ma'am no one is asking any other questions.
I'm there. I'll just share my number to everybody. If anybody has any problem, okay, I'll do one thing. I'll just text my mail ID with everyone, and they can connect to me whenever they are having a problem, right?
Sure, ma'am.
Thanks a lot, everyone, for this wonderful webinar and very knowledgeable. And I just show my gratitude to our Dr. Sanjeev Keja and Dr. Ruchi Vashna ma'am for providing us this platform. I just wish you happy day, and we are just winding up the webinar. And from IIP India Digital Team, I just thanks to you all, IIP Women's Cell, Ghaziabad. We will just believe that in future also, UP branch will conduct more webinars like this. Thanks a lot. Thank you.
Thank you so
Thank
much,
you,
sir.
sir. Thank you, ma'am. Thank you all.
Thanks to all participants.
Thanks.